Good evening, and welcome once again to another episode of Mind Matters. I'm Dr. Ryan Thompson. I'm Medical Director at Mind Matters. And with me this evening is Dr. David Simons, Clinical Psychologist and our Clinical Director. And this evening, along with the next episode we'll be talking about, we'll be kind of reviewing managing problem behaviors in children. A lot of our clients who come to Mind Matters who have autism, ADHD, learning disability, oftentimes have behavior issues that come to us through their parents, along with educators. And what we're going to hope to show you tonight are some tips on what are some typical behaviors you might see and things you might want to how you might want to manage them, along with potentially identifying what the source of some of those behaviors are. So to begin with, I guess I'd say, since this show is primarily targeting some of those individuals that we see most often, then they'll be tailored a lot to children who have ADHD, ADD, learning behavior issues, learning issues, and also some of the things that come along with that. A lot of children with ADD, which is attention deficit disorder or attention deficit hyperactivity disorder, have other issues that go on. So at least half the kids who have attention deficit disorder also have some other issues that are going on, often things like depression or anxiety, or a disorder called oppositional defiant disorder, which oftentimes will change a child's behavior. And so sometimes what we see is not just a child's behavior, but something that may be causing that. So part of what we're looking at is what is the behavior and how do we address it? And part of it is how do we look at the behavior and say, is there a source of the behavior we need to understand as parents or community members or educators? So the first I think I'd like to define is when we have a child and they have a behavior, sometimes we have to sort out from whence it comes. Is this something that's just a typical childhood behavior, or is there something that can be at least influenced by, if not caused by, something like ADHD or oppositional defiant disorder, or something else, depression, anxiety, self-esteem issues, something like that. So I guess my first question is, some people may not be familiar with what oppositional defiant disorder is, and since it's such a significant thing when a parent has a child with that it creates a lot of havoc both at home and in the school, I think I'll just ask Dr. Simons and see if he can give us an idea of what an oppositional child might look like and what that condition might be seen by as educators and parents.
Well, the term oppositional defiant disorder is fairly self-explanatory. Children are oppositional, and they're also defiant. Children are irritable, they're very demanding, they flaunt societal rules, they're argumentative, and these are issues that are outside of the norm of what's expected of certain ages developmentally. We do have certain developmental norms which we expect within these parameters most children to exercise as they grow up, but it's when these difficulties are out of the parameters, then we will classify it as oppositional defiant disorder. These children are very challenging, both in a controlled setting as a classroom and also at home.
And I'd like to add that something when I see as a flavor, as I see with children with oppositional defiant disorder, is oftentimes, instead of just being defiant, it seems to be something that's a reflex, that a child is automatically will say no, will automatically not do you've asked, and do it, like you said, it's beyond what you expect for a normal child, so it's a profound difference from normal. So a lot of kids may deny or defy you, but there's a sense of that it makes a difference. And kind of give me a flavor of what kind of response a parent might see to a child who has ODD, oppositional defiant disorder, versus a parent who has just a normal kid who may be having a bad day.
Well, again, it has to be determined if we're dealing with a child who has normal behavior, but he has episodes of defiance with his parents in terms of their rules, which is something we would expect with a child, as opposed to an opposite defiance child, where oftentimes it's instinctual behavior, and they will be confrontative. And my feeling is that we don't confront resistance, as that'll just be egging the child on to have more difficulties. So we need to really wait until this defiance subsides and not so much emotionally bound. Afterwards, we begin to deal with that by setting limits with the child, and we do this by having a sense of what is endearing to the child and withhold that, and hopefully he'll comply with our expectations and our suggestions of how to behave.
Okay. So just to wander into an example. So a parent may come to me and say, I asked my child to go feed the dog and he didn't do it. Is that being oppositional?
Well, certainly we could say that's oppositional. The child really wants some control over his own life and what happens to him. Again, really depends on the age of the child. But if there are expectations in terms of how a child should behave at home, we could certainly classify that as an oppositional type behavior, but it wouldn't certainly be within the spectrum of an oppositional defiant disorder. It'd be one specific behavior, and so in a sense it could be oppositional, but wouldn't necessarily be a diagnostic category of oppositional defiant disorder.
Okay, and I'd like to add to that is sometimes when a parent asks me that question, I have to ask more questions about it, because sometimes when they say he didn't feed the dog, that means that the child went out to the garage with the intent of going out to get the dog food, to put it in the dog bowl, but instead got distracted along the way, got involved in something else. And so, though they may say the child was being defiant, it wasn't really something where they're refusing to do it, but rather they didn't accomplish it. So sometimes I have to define with the parent, is they didn't accomplish it, or did they plant their feet and say, forget it, I'm not doing it, I'm not going that way. So part of that's to kind of define the behavior first and say that.
And it always occurs within the context of a family, and family dynamics certainly are something that needs to be addressed. An isolated behavior in and of itself would not necessarily indicate a significant disorder. It's a combination of behaviors. Now, if a child heading out to the garage and doesn't want to do something, it's important to understand what the parenting skills are like, and if both parents agree, if there's siblings involved, or he's just being oppositional to one specific thing, but he's taking it in context of really what happens within the family in terms of complying with the behavior.
And I think sometimes for a parent what's important to know is being able to distinguish the two behaviors. Something is he actively defying me, which needs to be addressed one way, versus that you just get lost on the way to getting there, which would be potentially that would be something you respond to differently. A lot of kids with ADHD are impulsive, and so a lot of times we see behaviors of kids who do things without where they shouldn't. So basically, I'll just throw that to you. So if I say a child is impulsive, help us understand what an impulsive act looks like. What does that mean? An
impulsive act is an instinctual act, whereas I always use the metaphor of when we as adults decide to do something, hopefully then we will stop and think about it. We'll decide if it's appropriate, what are the consequences, who's asking me, et cetera, then based on that consideration, we will then act. Impulsivity with children, it reverses the sequence. They will have a feeling to do something, they do it, then afterwards they will mostly recognize what they did, recognize that they shouldn't have done it, how it interferes with other people and bothers them, and more importantly, they promise not to do it again. However, within a short period of time, if the situation warrants it, they will do the behavior again, and the parent therefore assumes the child is just being oppositional and he's defiant and he's confrontative and does not want to oblige his parents' request, and that necessarily is not the case.
So an example like I just heard recently is I told my son not to jump on the couch. I get him off the couch, I take him aside, I tell him exactly what I don't want him to do. I do not want you to jump on the couch again. He nods his head, he seems to understand. He even repeat it back to me and say, what you just said was, I don't want you to jump on the couch. And then lo and behold, 20 minutes later, he's back on the couch. How do you counsel a parent regarding something like that?
Well, again, one has to look at the family dynamics where the child behaves in the context of the family. So the first thing I would do was I would sit with the family and understand what their personalities are like, their low frustration tolerances, their expectations of a child, how each parent prefers to discipline, and hopefully they'll both be on the same page. Then we address a child's behavior, because each parent might approach the situation differently and see the behavior differently. Some parents will just ignore it and say, they'll laugh at it and let's just forget it. Other parent is more rigid and strict, and we have to deal with it right away. So given the fact that we can have parents be on the same page in terms of how they do it, in terms of discipline, if it's repetitive behavior, that one has a sense the child is not aware of what he's doing at the time, that demands a lot of patience, and that demands each time he does is sit back and talk about it and understand that it might happen again, and we don't have a willful child. We have a child who has an impulse control problem, and it really is not something he can control, but we still have to bring an awareness to it, have him understand it, and hopefully as he gets older, he will then be able to control his impulses much more as he matures.
That makes sense. So it's part of what I see is sometimes is in what, echoing what you're saying, is that if you know a child has impulsivity and you know that it's not a willful act, as you said, then when they do that behavior again that you've asked them not to do, it's giving them a bit of grace, a bit of saying, I know you didn't intend to do it, I'm still going to address it with you, but I'm going to give you some grace because I understand that you didn't intend to piss me off.
Right.
So,
and grace doesn't necessarily mean permissiveness. What it means is that you understand your child, and we all as parents hopefully can do that, and that will dictate how we address them in certain situations. That's different from a child who is willful, who he will do that, he will look at us and smile, he will know he's defying us, he will know he just wants to assert himself. That's a very different situation, and that needs to be dealt directly.
No, and that's part of that is being able to, if you know your child well enough and you can see the look in their eyes as I talk about it.
Yeah.
So if you catch a kid jumping on the couch, like we just brought it up, and you say, Charlie, didn't I tell you to not jump on the couch? And he turns to you and he gives you those deer in the headlights look.
Yeah.
And he goes, oh gosh, here I am again. Then you can say, okay, I can kind of get it. Right. I can get that, versus if he turns and look at you and he gives you that, I did it on purpose look, I'm glad I got you mad.
Right.
It's a whole different ball of wax.
You're right. And I've talked to patients who are 6 or 7 years old, and the mother would tell me beforehand that, he just does things that drive me crazy. And then I'll talk to the child and I'll say, do you know what you do drives you crazy? And he'll smile at me and he'll say, yes, I do. And so it really depends, again, about the child and the dynamics, the family dynamics, and how they deal with the child when he does things, because most assuredly they all do.
Okay. Another behavior that I hear a lot about from parents is that everybody in the family has some chores to do. And Charlie, we'll keep using Charlie as his name, it doesn't have to be Charlie, but I give him 3 things to do. I want him to take the trash out, feed the dog, and then get his book bag ready for school next week. And every time I do that, he never gets it done. Therefore, he's being defiant again. He's not doing what I asked.
Okay.
And instead, I find him doing something else. How do I respond if I know he has ADHD?
Well, if we know for a fact it's ADHD, then we're talking about a child who has difficulty sustaining his attention to a task. He has difficulty following a sequence of behaviors, and thus he needs more structure and organization. Now, we can deal with that a number of different ways. We can separate the behavior into 3 different parts and have him first bring it into the garage, and then come back and let us know that he did that, and then maybe the next step into where it needs to be thrown in the trash, and then the trash. So it takes a little bit of patience by the parent, but if they understand that it's difficult for the child and it's not willful, he walks into the room and gets very distracted. And distractibility is not something that the children are conscious. It's an automatic response, and they don't realize they're distracted until after they go back to their topic. And this happens a lot in a classroom setting where your child is sitting in a class listening to the teacher, and then something happens in the window. A little birdie comes in and sits down, and immediately he focuses on the bird, and after a while he comes back to the task at hand, and the teacher will tell him, you're not paying attention. He will say, yes, I am, and argue with the teacher, because it's not a conscious decision to focus your attention on something else. And so when you come back, you're not aware of the fact that you weren't paying attention.
So in that same example, Charlie goes out to the garage. He's supposed to feed the dog. He doesn't even get that far. He goes out to the garage and he finds a tennis ball that he starts bouncing against the wall. I, as a parent, go out there 10 minutes later. I find that he hasn't even fed the dog. He hasn't done the first thing on the list yet.
Okay.
I'm angry.
Right.
How do I respond to the child? What do I tell him?
I would first ask the child, how do you understand what I asked you to do? Not what or why. Because if we ask what or why, oftentimes we'll get a parrot response. He will tell us exactly the words we used, and the assumption is that we, as parents, will assume he understands what we're talking about. But if we ask him, how do you understand what I said, he will say it, and we can walk it through with him. We'll go into the house, and we'll walk to the garage with him. We'll walk to the dog, and we'll feed him, and I'll ask him if he now understands what to do, assuming that he's going to remember a day later. And this might not be the case, so we need to have patience and follow the behavior simply once again.
You said the what or why question. No, my favorite is the why question. I tell parents all the time, don't ask the why question.
That's
because
right.
Say you go out there, we meet Charlie, he's in the garage, he's got a pencil up his nose and he's bouncing a tennis ball
Right.
off the garage
Right.
door, and you say, why aren't you feeding the dog?
And his comment will be, which will exasperate your parent, I don't know, or you didn't say that. And there's nothing more infuriating to a parent. What happens is then the parent and the child just get into it, and the focus then becomes less on the task and more on how he and the parent relate.
Perfect, yeah. And it's because there is no right answer to that. If you ask a why question, there's no answer that I know of that a child could say that would satisfy the parent. Because the truth is probably, I don't know.
Nope.
And that's probably the true answer. But is if you say that, the parent says, of course you know, because I already told you.
Right.
And so it sounds like a lie.
Well,
to
and the
parent.
risk, of course, is that the child will feel like they're doing something wrong and they're displeasing the parent, but they won't know why. And the concern we have as professionals is that this becomes a chronic, enduring trait. After a while, it's going to affect the child's self-esteem, their ability to be motivated, to try new things, and really accept the fact they're going to be successful. And that's not likely the case if we're continually telling a child, you're not doing what's expected, because it'll carry over into other parts of his life, and we certainly don't want that to happen.
So using a kind of a different type of behavior that we might see, if I have Charlie again, and we tell Charlie, I want you to go clean your room, and he turns and he looks you straight in the eye and he says, no.
Okay.
How would I respond to that?
Well, again, it depends on the child and what we expect. Now, my feeling is, or my sense of being in practice for a lot of years, is that children need to comply with their parents, because that generalizes into complying with rules outside of the home and knowing how to behave. So regardless of the problem the child's having, we need to deal with the fact that he has to comply with requests from a parent or authority figure. We don't want to do that punitively. But oftentimes what we can decide is we can set up the situation where there's consequences, and the child has to decide within that construct which choice he wants to make. Do I make the choice of cleaning my room and I end up getting something I want, or do I decide not to do that and I lose something I really like? Basically, it's between the child and the cleaning, not between the child and the parent. And oftentimes the parent puts himself between the child and the task, and they spend a lot of time dealing with their interaction with each other, and that's the parent either yelling and screaming and the kid doing the same, but he doesn't learn how to deal with the task.
So again, if Charlie says no, and he's planting his feet and he's staring at you, what might I do in the immediate term to say, okay, well, how do I deal with this?
Well, let's say Charlie loves to ride his bicycle and he's 7 years old. We'll say you have a choice. You can either decide to clean your room or you can lose your bicycle for one day. Now, oftentimes they will say, I don't care. Well, we don't increase no bicycle. We add something to the mix. Well, that's okay. Now, you can clean your room, or you can't play on your computer for the next hour, or your video game, or whatever it is that he really enjoys. Again, we set the parameters so he has to make the decision what happens to him, because then he has nobody to argue with.
What happens if I just force him to do it?
Well, I'd have to understand what you mean by force.
I yell at him. I drag him into the kitchen. I grab his collar and I force him into his room to go clean it.
Okay, again, that goes back to my initial premise, is that we have a child and we have a behavior, and what most parents do, and I was a parent, so certainly I can't excuse myself from this, is we get in between and we argue and we discuss and we yell, we scream, we threaten, we bribe to have the child do the behavior. What he becomes proficient at is dealing with the parent about the behavior, but he doesn't really get any practice dealing with the behavior. Secondarily, he's getting all kinds of attention from the parent, and he's feeling very powerful because his words are provoking the parent into behaviors that the parent is not really happy about.
Okay. Another example is we ask Charlie to empty the dishwasher. And we say, Charlie, I want you to go empty the dishwasher. And he looks at you, he says, okay, I'll go empty the dishwasher. And then he goes back to playing his game for a little bit. And then you go back in there and say, hey, Charlie, I thought I told you to go empty the dishwasher. He goes, okay, seems very agreeable. Doesn't seem like he's in your face and saying, forget it, go away. How do I handle that?
Well, one size shoe doesn't fit all. So again, it really depends upon the parents and their own personalities and how they view a child and how they were raised in terms of discipline and their own understanding of appropriate behavior at a certain age and expectations at that particular age and whether they think the situation is important. Some parents will just take it, it's no big deal, and they'll move on. Other parents will say, no, I was not raised this way, and this child obeys the parent. If he says no, and you're dealing with a child that you know does not have any disabilities in any kind, he's just being willful, then once again, you will set up a circumstance where he has to make a choice. You will either clean the dishes within the next 5 minutes, or there'll be a consequence, and the parent has to decide what that will be based on the child's interests.
And I would add to that some kids with ADHD don't have a good sense of time. They don't have a good sense of time planning,
right.
That he may really earnestly believe he's going to do the dishwasher, but he doesn't sense your urgency if you're saying it as a parent. Okay. So sometimes I think adding that last word to the end of it, I want you to empty the dishwasher now.
Okay.
So they know a timing, kind of a frame like that.
Sometimes ADHD children who have attention deficit, and there's a difference between ADHD and AD. Well, now it's both ADHD, but one of them, the children are impulsive and hyperactive, and the other one, they're inattentive and distractible. So they will present behaviorally very different. However, if time is the issue, then oftentimes if they have children internalizing and abstracting these things, we want to have a physical representation of time. So oftentimes if the child's playing and he's sitting there, you can either use anything such as an alarm on your watch or a 3-minute timer, so he gets in front of him and he can see visually the time is losing. It's 5 minutes and 4 minutes and 3 minutes, and he has a visual representation of an abstract concept, which is time.
So it gives him a way of sensing that
Absolutely.
Time passing then.
Yeah.
Makes sense, okay. So another thing I oftentimes see in parents, or hear about from parents, is the whole bedtime routine. Mm-hmm. That it's 8 o'clock, bedtime's 8:30, and that they spend 45 minutes trying to do a 10-minute task getting a kid to go to bed because of a lot of distractions, not getting things done, coming in and out of the bedroom, not falling asleep, things like that. And it seems to be more frequent in kids with ADHD. Do you have any suggestions on getting the bedtime routine down?
Well, first of all, it would be very important that the sequence of events is consistent throughout. In other words, if we have dinner at a certain time, then it'd be homework, then bath, then bed. We cannot vary that with children who have attention deficit disorder for the most part, because they are distractible, they are disorganized, and partly if it's a question of the child just forgets what he's doing and he plays with another task, that's one thing. But if he understands what has to be done and he's just being willful and oppositional, that's another issue. And that goes back then to how the parents can deal with him. Again, it really has to do with consequences. And we can't have a child yell and scream and hit and fuss and throw when it's time to go to bed. There needs to be a winding down period. You can't be watching television till he goes to bed, or playing a video game till he goes to bed. Those things are very stimulating. So what we try to do is control the environment, so that if he has to be in bed at 8 o'clock, at 6 o'clock there's homework and a bath, but then there's quiet time, there's reading in your room. You don't have to go to sleep, but you got to stay in your room. And most of the time, if there's no external stimulus like video games, etc., he'll basically quiet down and stay there.
Okay. I hear a concern sometimes from parents is that once we, quote unquote, label a child as having ADHD and that the behavior persists, that they're concerned that, is that giving my child license to be bad behavior? Is he going to use that as an excuse? I have ADHD, therefore I can't empty the dishwasher. So it gets them off scot-free, and that some parents are very concerned about that. Mm-hmm. How do you respond to that?
Well, sometimes we label, and children can use that. Well, I'm the biggest kid in class, so I can get away with this. I'm the best kid in math, so I can do this and that. Or I have a bad foot, or I have a bad leg, or I have ADHD. And basically, we don't want the child to believe that that's a crutch. And that has to do with how parents deal with him from the beginning, that we all have difficulties, we're all different, But that isn't an excuse not to do something. And again, it has to do with self-esteem and self-pride and motivation. And this comes from the parent, not the child. We all have certain abilities, and everybody's different, and we don't use our lack of ability to kind of inhibit us to go on and do something successful and great.
Okay. One last example. We had talked before about a child having clothes all over the bedroom floor, and that parents say, okay, go and clean up your room, go and clean up your room, go and clean up your room. And it never happens. So what kind of a plan might you give a parent with that situation?
Well, there's a lot of different ways to deal with that. But my feeling is, and what I've done in the past is one way to deal with it, is that we don't want to always get into argument with the child. So sometimes what we do is we get a basket or we get a large, 32-gallon garbage can or something. We put a liner on it and put it in the garage. And we tell the child, anything on the floor, I just assume you don't want. So it's going to go in the bucket. And we don't get mad at the child. We don't get angry with him. We don't yell at him. We don't tell him it's a bad behavior. We go into his room at night and we scoop it up. We put it in the bucket in the garage. We don't throw it away. And when he wants to know where it is, which he absolutely will say, Mom, where's my jacket? He says, oh, it's in the garage. Well, sooner or later, he will accept the fact that if it's on the floor, he won't do that. However, then you might find it on the bed, and that's a different situation entirely.
What about the issue of fairness? So they have a child with ADHD, and you have a child without ADHD, and one sibling's going to notice the other sibling gets treated differently. How do you deal with that?
Well, again, it depends on how old the child is. And it is a fact of life that not everybody's the same. And no matter if the child's ADHD or not, we treat our children differently. We try to think we're going to treat them the same, but we really don't, because they have different personalities, they have different likes and dislikes, and their needs are going to be different. Some children are fairly reserved and they need a lot of structure. Others are really outgoing and they don't. They're not having issues about leaving their parents. That's part of living, is that people are treated differently. And I think that we need to do that without using an excuse and saying, well, it's because he has this problem. We all have problems one way or another. And it's only fair to say he's treated this way because we treat people differently and not label it.
So being able to, again, in a sense, teaching the sibling to allow grace for their brother or sister, yet not being too much, not showing too much in the way of favoritism.
Right, so, and I think that what we don't want to do is to have the sibling say you're letting him get away with stuff. But again, I think it's very important to let the child know that children are different, and we deal with each of our children differently. And one child is able to do something, the other one is not. So if one has ADHD and can't do something, there's no doubt in my mind that the one who doesn't certainly has issues in another area that he can't do. And these are things that need to be explained and shown.
Great. So with the next episode, we'll go through a little bit more. So thank you for listening.